Respiratory services treat and manage diseases of the respiratory system or the breathing system. These conditions and diseases can include chronic obstructive pulmonary disease or COPD, chronic bronchitis, emphysema, and other conditions such as bronchiectasis, asthma and lung fibrosis. Services in Rotherham, compared to other areas in South Yorkshire and Bassetlaw, are facing some challenges. More patients are admitted to hospital, especially those with urgent medical needs linked to COPD, asthma, influenza and pneumonia. Services between hospital and the community are not integrated. We have a shortage of respiratory doctors, nurses and other healthcare workers, and patients are not always getting the best outcome from the care they receive. Whilst hospital is the best place to be for urgent and complex respiratory conditions, it is often better for patients to receive treatment and support in the community. With this in mind, we are reviewing our respiratory services and have looked at best practice across the country to help us redesign services for patients in Rotherham. We are proposing the following. Your GP practice is still the place to go for the ongoing management of your respiratory condition. So that we can be sure everyone receives the same high standard of care across GP practices in Rotherham, there are some tests which are more specialised, such as spirometry, and we are looking at how this is provided, as it is difficult for all practice staff to be trained to this level. Therefore, we are exploring whether some practices provide more advanced input, or whether it is appropriate to have a small number of practices providing this service. The Community Respiratory team have been predominantly working in breathing space bases, and it is proposed to increase this team and provide services from 8 AM to 8 PM. If you have a flare-up of your COPD, the team can support you at home to prevent you having to go into hospital. If you do go into hospital, they can offer home support after discharge. Pulmonary Rehabilitation is a 6-week, twice-weekly programme of exercise and education designed for you. It improves breathlessness and well-being. It is run by expert physios and therapists. They have a rapid access phone line for advice and support. If you develop pneumonia, the team will assess you and decide whether it is safe to support you to recover at home to prevent you being admitted to hospital. And if you do have to go into hospital, they will work with you to help you return home earlier. The home oxygen service will provide a full assessment in a clinic setting and follow-up at home and in clinic, tailored to your needs. Breathing Space will continue to provide a range of respiratory outpatient clinics and follow-up. The supported discharge team will be based in Breathing Space. If you do need inpatient care, this will be provided in appropriate setting, such as a hospital or hospice, rather than within the Breathing Space building. We are confident these changes will improve the experiences of patients using respiratory services in Rotherham. Get faster, more accurate diagnosis of respiratory conditions, manage patient conditions more effectively, improving their clinical outcomes, improve primary care management of respiratory diseases, reduce the risk of patients being admitted to hospital, and, when they do have to go into hospital, make sure that patients get home faster and with better support. For more information, visit the website.